We know that there isn't a level playing field for everyone in health. Some people have privileges in relation to accessing health services, while others have disadvantage. And there's another important factor beyond just accessing health services. Getting good health, acquiring good health, keeping healthy is a complex thing, because it's not just based on whether you've got access to health services. There are a range of factors that contribute to our health: our education, our upbringing, the experiences we have in our community, whether we experience even racism and discrimination can have a deep impact on our health. That's what the research tells us. So health is complex, as I said before, and it is a priority within the Ministry for Ethnic Communities to make sure that ethnic communities have access to health and to participate in the transformation of the health system that's going on.
We've used the term leveling the playing field a bit today. I remember when I was a kid in Colorado, we would play, the kids on the street and I would play, we like to play football, American football, as in gridiron. And there was not a playing field, but an area where we played next to our sort of subdivision where we lived. But it was literally not level. And so at halftime, you had to change sides. And every time, the kids who were on the upper side for the first half always won the first half, and the kids who then switched over to the second half, they always won the second half, because that's just how it works. It's time to switch sides now, right? We've had an unequitable playing field for too long, so we need to literally change sides, give the other side a go at playing from the top end of the field.
Access to GPs is a huge issue still for anybody in Aotearoa. But I think for people with English as a second language, people with quite different cultural needs, access to GPs is quite a serious problem that we're seeing emerge more and more. Access to interpreters. So while the Ministry of Health, the government says that the health system needs to use interpreters, they must provide interpreters. People have the right to have an interpreter. People don't always know they have that right. So there's really good best practice happening, but there's also some pretty poor practice happening in terms of interpreters. And I just want to acknowledge Pegasus and the work they've done around this and the healthcare system across Canterbury.
Māori do not experience health services in the same way as non-Māori, right? But the hallmark of our wonderful society of Aotearoa, and I'm not being facetious, there are wonderful parts of our community, is this whole assumption that one system suits everybody. And if it doesn't suit you, that's not the system's problem, that's your problem. So we need to change that so that there's explicit recognition that one system does not suit everybody, and that the system needs to be flexible, needs to be adaptable, and needs to work with the communities that it serves. So I know that Abbe's going to talk more about how the health reforms are going to start to bring that about, but lovely to be here today.
Thank you, Aroha.